You know, if you're already struggling, this pandemic really has to be taking a toll on you. Dr. Anthony Chico, Medical Director of Emergency Psychiatry at GBMC, joins us now. Thanks for joining us, Doctor.
Hi, thanks for having me. I appreciate it.
You know, this is such a stressful time for all of us. You have the highs and then you have the lows. What really is the best way for us to maintain our sanity? Because I'm about to lose mine.
Well, I think you've heard this from a lot of others in the press, but it really does start with having some routine, having some pattern. At a time where there's a lot of uncertainty in this world, having something that we can count on, some predictability in our life is important. So, you know, having that routine at home, even if you're not able to go to work, is critical.
You know, that said, though, I feel like every morning I'm in an episode of Groundhog Day because I wake up, I do the same thing. Is there something to be said about maybe breaking that up every once in a while?
No, absolutely. I think on any given day, it's important to diversify your day. Spend a little bit of time outside if you're able. Mix up your activities is so important. I also think having a chance to reach out to others, obviously from a social distance, is important. Having a sense of purpose, whether it's mowing your neighbor's lawn if they're elderly, picking up a few extra groceries, all of these things are important, not just to help our neighbors, but to help ourselves, having, again, that sense of purpose and direction.
You know, I think about what about folks who maybe already have a pre-existing mental health condition? You got to worry about them as well as people who live alone during times like this.
No, for sure, for sure. And I would say in those situations, someone who's already engaged in treatment, simply continue the pattern of treatment that you've been receiving. Obviously, if you're taking medicines, please continue to take your medicines as prescribed. And secondly, you know, continue to reach out to your providers for those regular appointments. A lot of my colleagues now have made that leap into the virtual world of treating people remotely. And thus far, I'm actually pleasantly pleased how well, at least personally, I've found that to work. So, you know, if you're in treatment, keep doing what you're supposed to be doing.
All right, Dr. Anthony Chico, stay safe, and thank you so much for joining us.
Thank you. I appreciate that.